आज टिप्स के बारे में, क्या करना चाहिए क्या नहीं करना चाहिए, डाइट, एक्सरसाइज, होम मॉनिटरिंग, सेल्फ केयर, हर चीज़ के बारे में। अगर आपके कोई क्वेश्चंस है तो डेफिनेटली क्वेश्चंस लेंगे एंड यू कैन कॉन्टैक्ट मी फर्दर फॉर एनी ऑफ योर क्वेरीज. सो लेट्स स्टार्ट. Okay, let's wait for our viewers to have some questions. So, pregnancy is a state जहाँ आपको बहुत ही careful रहना है. I want to say that first 3 months में you have to be extremely careful regarding your diet. In fruits we say raw papaya, pineapple नहीं लेना, tea, coffee consumption कम से कम रखना है. इसके अलावा high mercury fish या seafood avoid करना है. Apart from this, everything cooked, home food, everything is allowed. Light walking and exercise can be started right from the first trimester, that is the first 3 months. Okay, we have a question. Besides healthy diet and supplement, what other factors will support my pregnancy health? So if you are planning a pregnancy plan करने के 3 महीने पहले is the ideal time कि आप अपने गायनेकोलॉजिस्ट को विजिट करो. हम टेस्टिंग करते हैं कभी कभी दोनों पार्टनर्स की, दोनों को कोई सप्लीमेंट्स देने होते हैं. फोलिक एसिड आइडियली शुड बी स्टार्टेड 3 months बिफोर यू इवन गेट प्रेग्नेंट, और as soon as you get pregnant, your gynecologist will start you on folic acid and other supplements. हमेशा एक एक्टिव लाइफस्टाइल रखो. बोथ पार्टनर्स नीड टू make sure to quit any addictions pre-pregnancy. So anything like tobacco, drinking, smoking, ये सब प्री प्रेगनेंसी ही बंद करना है. ड्यूरिंग प्रेगनेंसी मेक श्योर यू आर एक्टिव ऑन अ डेली बेसिस. ऑफ कोर्स कंसल्ट विथ योर गायनेक इन केसेस ऑफ सर्टन कंडीशंस. हम बेड रेस्ट कह सकते हैं, बट अपार्ट फ्रॉम दिस एटलीस्ट वॉकिंग और योगा 30 minutes डेली, and healthy food, all supplements and medications as prescribed by your doctor, regular visits and regular ultrasounds. Okay, there's one more question that I can see. Is there any extra care I should take when having twin pregnancy? So, अगर आपको twins है, congratulations. It is a very exciting time, but of course you need to be very careful. Twin pregnancies में there are some high risk factors. One of them can be that आपको risk of high blood pressure, risk of diabetes ज़्यादा होता है. So regular visits to your doctor. Diet का बहुत ध्यान रखना है. You have to take an additional 300 kilocalorie per baby, and you have to have optimal amount of iron and protein in your diet. Calcium and vitamin D as prescribed by your doctor as well is very important. Take a healthy and balanced diet. Be active. Another risk in twin pregnancies, of course, is of risks of abortions, risk of preterm labor. So be very careful to have regular visits. And in cases of any pain or any kind of leaking, visit your doctor immediately. I can see one more question. I'm 5 months pregnant and I have been diagnosed with pre-eclampsia. तो सबसे पहले ये pre-eclampsia क्या है ना? What care should you take for this? So in very simple terms, a blood pressure of more than 140/90 on at least 2 readings, along with protein in your urine or involvement of some organ. This is pre-eclampsia. High blood pressure होता है ये pregnancy में. So to combat it, the simple things that you can do first of all is to restrict salt completely in your diet. Have some activity, 30 to 45 minutes of walking or yoga daily. Keep a home blood pressure monitor and check your blood pressure at least twice daily. There are some symptoms to look for. If you are feeling like you have a lot of nausea or vomiting outside of 3 months of your pregnancy, burning in this region, any blurring of vision यानी धुंधला दिखना या हेडेक होना, these are all warning signs कि आपका blood pressure बढ़ रहा है. So in this case, you have to visit or contact your gynecologist immediately and they will guide you. Keep a check on your blood pressure and your diet for sure. One more question is coming up. I am 1 month pregnant and I have borderline high blood sugar. What extra care should I take? So usually there are various types of raised sugar, yani diabetes in pregnancy. Some can be that the patient is already diabetic before pregnancy. So in this case, we do blood sugar checking. We do a glucose OGTT or an early glucose tolerance test, and we do a blood शुगर टेस्ट कॉल्ड HbA1c. ये टेस्ट हमें बताता है कि लास्ट 3 मंथ में शुगर कंट्रोल कैसा है. Just in case your HbA1c value is above 6.5, then your gynecologist will take a decision on when you can plan pregnancy. If you are already pregnant and your sugars are high, of course it's very important to follow a diabetic diet. So everything sweet and processed is to be stopped. Even fruits, sweet fruits are to be avoided, and remaining fruits are to be restricted to one a day. Just if you want to have rice, switch to brown rice. Try to have it earlier in the day, and take frequent small meals. Activity is very important in this case. Again, 20 to 30 minutes of walking or yoga twice a day is advised as per your gynecologist's instructions. Make sure you have a home glucometer. Make sure you have a home glucometer. That means a machine which checks your blood sugar along with the strips at home. Make a chart and definitely send this chart to your doctor so we can guide you further. In cases of diabetes in pregnancy, there are chances of two things. If it is very early, then there may be growth restriction, and if diagnosed later, the baby may be bigger than usual. So, frequent ultrasound, and in later stages, color ultrasound. That means color Doppler is very important. Your doctor will advise you for the same. One more question that I can see here on my screen is, I have short cervix and I'm on progesterone tablets. What home care and precautions should I take? So first of all, है ना, जिनको जानकारी नहीं है, the cervix is the mouth of the uterus. We have one uterus, the mouth is the cervix. There are two tubes and two ovaries. If the normal cervical length is shorter than usual, देन देर इज चांस के अबॉर्शन हो सकता है, टाइम से पहले डिलीवरी यानी प्रीटर्म डिलीवरीज हो सकते हैं, प्रेगनेंसी लॉसेस भी हो सकते हैं. सो दिस इज टू बी मॉनिटर्ड ऑन एन अर्ली अल्ट्रासाउंड. एंड इफ द सर्वाइकल लेंथ इज शॉर्ट, then usually we do two things. One is we keep the patient on some support, either maybe some progesterone tablets, some injections, and also bed rest is advised. Apart from this, we may also advise a stitch on the mouth of the uterus. This is called a cervical cerclage. So definitely consult your doctor as to when and how much progesterone you have to take, whether you require a stitch, and when it is to be put. Ideally, the stitch should be put between 11 to 15 weeks of pregnancy, and this then it is most helpful. Make sure that you consult your doctor immediately if you have any pain in the lower abdomen, backache, thigh pain, or any leaking. Usually pregnancies with short cervix are termed as high risk pregnancies. So it is very important that the patient takes adequate rest, consults with the doctor regularly, and can visit the hospital at a short term notice. We might even admit these patients towards the end of their pregnancies. So, in times of COVID, I just wanted to say that there are some things that every pregnant lady should have at home. Number one is a blood pressure machine, so they can check their blood pressure. For those who are at risk of diabetes or who have diabetes, they should definitely have a glucometer. There should be a saturation probe, that is an SpO2 monitor at home, so they can check that as well. A thermometer to check their temperature. And of course, easy and comfortable access to your gynecologist. So, my take home message from today would just be that a pregnancy is not as easy as it's made out to be, but it's not very difficult as well. Just try to be active, try to eat healthy, carry out your daily routine tasks, of course, after consulting with your doctor, and just try to enjoy this period because it's not may not come back. Just be well informed, be well read. You can consult us on the Baby Chakra app. You can look up Instagram at Ask Dr. Akanksha. And of course, we have access to many resources nowadays. So just make sure that you're well informed and you take adequate precautions so that nothing goes wrong and you can have a happy, healthy, and safe pregnancy and delivery. So I am a consultant gynecologist. I'm working at Sumitra Hospital, Noida, and I'm specialized in the field of laparoscopy and IVF as well. So we've dealt with people who have difficulty conceiving, with difficult and high risk pregnancies, as well as with patients who have faced all issues like preeclampsia, diabetes, short cervixes. So I just want to say that COVID time has been very difficult for most of the people, because of, you know, not able to leave their home, not enough access to doctors and healthcare staff such as dietitians, physiotherapists. So now that, you know, everything is going digital, just make sure that you are connected to all the best healthcare professionals, and you are मेकिंग श्योर दैट यू टेक केयर ऑफ योर हेल्थ, क्योंकि अगर आप आपका ध्यान रखोगे तो आप अपनी फैमिली, अपने बच्चों का ध्यान रख पाओगे.